Thank you, Professor Howling, for this very interesting overview and talk. And there's now opportunity to ask questions to Professor Howling. So I see a question over there. You can have the floor. There is a microphone there, and maybe. Do you want to be here?
Can I ask a question now?
Yes, sure, sorry. Carry on.
Yeah, I'd like you to talk a little bit about those 1% that you mentioned in the beginning, how they differ on different diagnoses, and how big a percentage is PPD and OS, and what kind of implication does that have? I mean, what are the percentages here within this range of 1%?
I've forgotten what the exact proportions are, but the numbers of sort of classic autism are the smaller proportion of the percentage. So there's more children with, it also includes children with atypical autism, with Asperger's syndrome, and this also some children with this much less well-defined category of PDD, NOS. So I think what makes up this 1%, as you say, is an important area now to begin studying, because of course the implications of early diagnosis in the different groups may differ as well. But the sort of core autism is probably the minority. It's the sorts of children who weren't being diagnosed, say, 10 years ago, who were added to the numbers being diagnosed.
Are there any other questions?
Thank you very much for this wonderful presentation. I would like to ask about any programs that you are aware of for children of self-educating nature. I practice in a community in Atlantic Canada, and I came across a couple programs that were developed in North Carolina for kids with Asperger disorder, teaching them what do they have and how to manage it. My one particular patient was so thrilled when he heard that he has Asperger disorder and he's not crazy. He was very happy, and the teachers were continuing this program with him. And if I missed the part of that presentation that maybe you talk about it, I apologize, but I would like to hear if you know anything of those kind of programs.
No, sorry, I'm losing my voice. I didn't mention it, but I think it is a very important aspect, and particularly dealing with some older children or young teenagers. What Asperger's, particularly I think the high functioning children, obviously, what Asperger's syndrome is, what it means to you, that sort of thing. In fact, there's a little bit in the booklet. We haven't got any copies of the booklet. There is a booklet going around that's been developed for children with a range of problems, from ADHD to epilepsy and that includes children with Asperger's syndrome and autism. Just a couple of pages on what it means to you to have these conditions. But this is it's just choosing what's best for you, developed for child and adolescent mental health services with bits of information for children with a whole range of problems. But for the Asperger group, there are a lot of publications now. The National Autistic Society in the UK, and I'm sure lots of other societies, American societies, have books particularly about Asperger's syndrome and what's good about Asperger's syndrome. People who've attained a great deal in life. I mean, examples like real life examples like Temple Grandin and so forth, who've used their particular well, in her case, particular obsessions and skills as a child, to carve out an extremely successful career, in her case as an animal psychologist, and also pointing out that there may be many other famous people out there who've got this condition and done very well because of it. So selling the positive aspects as well as explaining why they may have difficulties in some areas. So certainly materials designed very specifically to boost self-esteem and make kids feel good about themselves. What the impact is, I don't know. I mean, there's no studies of these sorts of materials, but it may well be that that sort of approach early on might, reduce the numbers of children developing sort of depressive type symptoms, because a lot of them are to do with feelings of very low esteem, not being excluded and that sort of thing. So I think there's a lot of scope for developing these materials. There's less in the way of help for children functioning at lower levels, where of course the explanation is really coming from families and teachers.
Thanks for your talk. Nice to hear you discussing some Australian research, but just to balance that, the cattle prods are still around. There was something on Australian TV a couple of weeks ago suggesting trying cattle prods.
Really? For what sort of...
just one of those current affairs programs, autism epidemic, parents don't know what to do, and showing horrible videos of kids getting electric shocks.
Really? I mean, that's the trouble, these things do. You think they've gone and then they suddenly pop their heads up again. So, but certainly, on the whole, there's some excellent work coming out of the Australian centres, particularly the RCTs they've been developing there. And a lot of work on anxiety management generally, not just with autism kids, but with other groups of kids as well.
So, do you have a question over there?
My name is Björn Vrangsjö from Sweden. Thank you for a nice presentation. To my mind, also other kinds of treatment modalities have been actual for these kids. For example, some kinds of music therapy and dance therapy and things like that. Have they not shown up in any reports about outcome or in the studies you looked at?
Yes, that's really why I didn't include them. I think there's all sorts of strategies out there, and certainly at a sort of theoretical level, one would expect music therapy to work well, because it involves reciprocity, listening. It can be timed to suit the child with autism, and certainly some children, and often some children have got excellent musical sense. So I think it can be very helpful. There's been a bit of a problem with music therapy because some people have again said, published papers, single case papers saying this child had music therapy and he was cured of his autism. I don't think there's any evidence that music therapy can cause autism, but as part of the educational program for children with autism, I think it's very helpful. And there's very few schools, specialist schools, who wouldn't have some form of music therapist involved. But there's all sorts of other things as well. Of course, there's occupational therapy. Many children, or physiotherapy. Many children have physical problems, are clumsy, can't do buttons or laces, and that sort of approaching it. So there's lots of different approaches that are needed. I haven't tried to include all of them, really just the ones for which there's specific evidence. And just general speech and language therapy that I didn't mention either, again, can be very important, particularly if it's focusing on broader aspects of communication.
Over there?
Since we're not so many, I can ask one more question maybe. My name is Niklas Borrell from Sweden. I didn't present myself last time. I was wondering, it was kind of, or I was struck by those two diagrams that you showed that normal nursing program was just as effective as a very directed program, and I was wondering how you interpreted that finding. Did you feel that, well, these children are very much going on one track and you can't do much about it, or what were your own reflections when you saw those results, that they were so similar, those two results?
Well, these were rather exceptional nurseries. So they were nursery schools where the teachers had got really, some of them were exclusively for children with autism, some were for children with mental retardation, but where teachers had a specific experience in children with autism. So they were really rather special nurseries, and I think it was because the teachers were using a lot of behavioural approaches, but it just wasn't like the Lovas approach in terms of the very high intensity and the manualisation of the programme. So I think, and the children did make improvements in both groups. And I think our interpretation is that, if you place children in any good specialist programme early on, they're likely to make progress. I think the trouble is that many of them are not in good specialist programmes. They may be in nursery schools, although it's quite difficult to get very young children into nursery school, but they may be in nursery schools where teachers really aren't properly trained with this group, don't really know how to develop their skills or the best ways of minimising behaviour problems. So I think general nursery placements, there's not much evidence that they work, but in a specialised placement, that can do just as well as a specialised home-based placement. And of course, what we didn't do was look at the social skills, the social ability of the children, because it may be that the children in a school setting actually have better social skills because they have to interact with other children there. We are looking at that now in our 7-year follow-up to see whether that has been advantageous whether the school group has advantages there. But I think the message is you need highly skilled intervention to make progress, but evidence that one type of highly skilled intervention is much better than another isn't really there at the moment.
Are there any other questions to Professor Howlin?
I think everybody probably needs coffee, having got up so early in the morning.
In that case, I thank you very much for your attention, and Professor Howlin again, thank you very much for your interesting presentation.